health in patients with myocardial infarction. I am your presenter, Rayehe Norouzi. Here's my information. You can call me or either send me a message via WhatsApp, LinkedIn, or email me. Here's an abstract. Let's get through what we're going to review about. Health research is essential for improving healthcare systems and addressing health inequalities, particularly highlighted by the Commission on Social Determinants of Health in the Eastern Mediterranean. This report emphasizes the need for social justice and equitable health access, suggesting actionable recommendations for policymakers, including equity promotion, focusing on universal health coverage, examining economic equity, ensuring financial protection, and enhancing target subsidy law in Iran, which aims to improve health financing equity. However, challenges like rising healthcare costs persist. Ultimately, to enhance health outcomes and quality of life, ongoing research and policy initiatives are crucial to overcome healthcare inequalities and achieve the 2030 Agenda. Non-communicable diseases or NCDs are a major global health issue, causing over 36 million deaths annually, with 63% of global mortality attributed to these conditions, particularly impacting low and middle income countries. Cardiovascular diseases or CVDs, especially coronary heart disease, are a critical concern in Iran, where they accounted for a significant mortality rate, leading to a loss of thousands of life years daily. While developed countries see declining mortality rates due to effective public health initiatives, developing nations face rising CVD burdens linked to lifestyle changes, which threatens healthcare systems and exacerbates health disparities. Addressing these challenges through preventive strategies is essential for improving global health outcomes. Acute myocardial infarction or AMI poses grave risk, with mortality highest in initial hours post-symptom onset. Complications are recurrent ischemia and reinfarction underscore the urgency of timely treatment, which significantly influences survival rates and quality of life, impacted by social and psychological factors. Meanwhile, developed nations have seen declining cardiovascular diseases or CVDs mortality rates due to effective public health initiatives, while developing countries face rising CVD burdens due to unhealthy lifestyle shifts. This creates economic challenges and highlights the need for global prevention strategies. Health research is vital in addressing non-communicable diseases or NCDs and improving healthcare access, particularly in developing areas, thereby enhancing overall health outcomes and quality of life. Health research is vital for enhancing healthcare systems, as emphasized by the Commission on Social Determinants of Health in the Eastern Mediterranean report on achieving health quality. Key recommendations include promoting healthcare and educational equity, ensuring universal health coverage or UHC, and utilizing tools like the Kakwani Index to access health financing equity. Financial protection is crucial for equitable service access, with initiatives like Iran's target subsidy law showing promise despite challenges, addressing healthcare social injustices, particularly related to cardiovascular diseases. It is essential for improving patients' quality of life. The intersection of socioeconomic status and health outcomes, particularly in cardiovascular diseases, has emerged is a critical area of research. This discussion compares the findings outlined in the literature review with key insights from the results and conclusion section of a significant study, emphasizing the implications for health equity as well as health policy. The literature review synthesizes various studies that illustrate how socioeconomic factors influence the incidence and management of cardiovascular diseases. The comparison between reviews and our conclusion sections on this article shows the link between factors of socioeconomic life and health outcomes. The review highlights studies on access and treatment disparities, emphasizing psychological and financial aspects. In contrast, our results suggest systematic changes like universal health coverage for health equity. Both sections stress the need to eliminate socioeconomic influences on health, yet the review focuses on studies while the conclusion offers actionable policy recommendations. The results and conclusion section builds upon this foundation, advocating for systematic changes to achieve health equity. First and foremost is equitable access to healthcare. The report from the Eastern Mediterranean laments health inequalities and advocates for poverty alleviation and enhanced education access, particularly in wealthier nations. Second is universal health coverage or UHC. Aligning with the 2030 Agenda, the focus on UHC aims to ensure that no one is left behind, emphasizing the importance of equitable healthcare opportunities. Third result is economic equity measurement. The Kakwana Index or KI is presented as a vital tool to assess healthcare financing equity, providing a metric for progressiveness or regressiveness in funding mechanisms. As a function of healthcare systems, financial protection is very important. The WHO's assertion on the necessity of financial protection reinforces the need for frameworks that shield vulnerable populations from high healthcare costs. These include catastrophic costs too, which completely can ruin or hurt the family financially. Therefore, health subsidiary plans, from the healthy to the ill and from the rich to the poor, can also help pooling of financial protection. Moreover, health insurances are so equitable and practical in terms of financial protection, especially when it comes to the term of such unpredictable illnesses like cardiovascular diseases or myocardial infarction. Most people are not aware of the risk of illness, therefore, a health insurance will help them not to get broke during the catastrophic costs. As mentioned, target subsidy law is a way to financial protection. Target Subsidy Law or TSO initiative has shown promise in increasing financial equity, yet it also faces challenges such as rising healthcare costs. The conclusion indicates that addressing social injustice and financial inequalities is imperative to enhance health outcomes, particularly for populations suffering from CVD. Both conclusion and results emphasize health equity as a fundamental goal, advocating for strategies that ensure that socioeconomic disparities do not dictate health outcomes. Also, it is important for the financial mechanisms to promote equitable healthcare access, explicitly referring to the role of direct taxes and subsidies in enhancing financial equity. As a conclusion, health equity focus is important. Research highlights health inequalities essential for improving healthcare systems. Key recommendations are aim for equity. Wealthy nations must enhance access to basic necessities for all. Universal health coverage is the second one. Commitment to SDG 3, leaving no one behind by 2030. Also, measuring health financing equity, which is crucial for assessing progression and finding, like Kakwani Index, Gini Index, and etc. Also, it is important to care about financial protection and key initiatives. Financial protection. WHO emphasizes its importance for equitable healthcare access. TSL in Iran increased Kakwani index, improved financing equity, yet challenges persist yet, like rising costs or access disparities. Importance of economic tools like utilizing concentration and measuring economics by Kakwani index to analyze healthcare disparities. Conclusion and future directions. Addressing social injustice. It is essential for better health outcomes and quality of life for all. Focus on cardiovascular diseases. Understanding economic impacts on heart attack patients. As long as a myocardial infarction is not predictable, so the risk of financial costs is always appeared. Also, aligning research with health financing policies to improve access and quality of care, along with path forward, ongoing research and policy initiatives needed to create equitable healthcare systems. Here's a list of the selected references. As you can see, some of the references were used in the background, literature review, or other section parts. The discussions, of course, were combined with these references, literature review, and our conclusions. And we have got a comparison between these references and our conclusion. Dear professors and participants, feel free to contact the author for any discussion or further collaborations. Thank you for your attention. I wish health for everyone. Happy New Year. Have a very nice lasting day.